So we have our Shockwave machine set up and prepped for a demo treatment so we can give you an idea of what it looks like when we are treating with a patient. But kind of to go over it real quick, usually our treatment protocol is going to be anywhere from 4 to 6 weeks, 1 to 2 times a week, depending on how long the patient has been dealing with their condition, how they're responding. It will fluctuate from there. Throughout the treatment, there's a couple different parameters that we can play with. One is the frequency of impulses that are being transmitted into the tissue. So we can either go 0 to 12, and usually this is going to give the patient some bit of comfort. Actually, the higher frequency usually is a little bit more comfortable for the patient. And then the intensity of the energy that's being transmitted into the tissue, we have a scale of 0 to 18. So usually early on in treatment, the patient is going to need that intensity to be a little bit on the lower end. We'll usually start anywhere from 6 to 8, depending on how the patient is receiving that or how well they're able to tolerate that intensity. We'll kind of change it from there. But as they progress through the treatment plan, you'll see them be able to tolerate much higher intensity, and that is usually better for the tissue. You're going to get a better response as far as the breakdown of the scar tissue, the response as far as the vascular formation, so more blood flow. So usually we try to encourage the patient, if they can tolerate a little bit more, then we'll do so. It's usually not a very uncomfortable treatment. I liken it to a dull toothache. This is a very similar modality to being in the dentist, I guess. But sometimes the patient will feel similar pain to what they experience when they are participating in their activity and their knee hurts, if we're treating the knee or the elbow, vice versa. So it may even replicate their pain symptoms. After the treatment, they're not going to have a whole lot of soreness. That's what's really nice about this modality specifically, is there's not going to be a whole lot of soreness or effects post-treatment. If there is, those effects usually resolve within 12 hours. So they can participate within our structured recommendations. They can kind of get back to some sort of activity. And we usually tell them to refrain from icing because we want those effects to take place. That ice may counteract what we're trying to do with the treatment and with the effects that are going to occur in the tissue from the shockwave. So we'll get a patient in here. I think we're going to treat a knee. We'll kind of show you what it's like while we do so.